Okay, so the next category that we're going to talk about are antilipemics, which the overall goal for all antilipemics is to decrease lipid levels in the body. Wow, so amazing. Blows your mind. So typically doctors want patients to use this drug with a diet and exercise. And ideally they would try diet and exercise before going on these drugs, typically 6 months. So just general things you should know. Try it with diet before you use these drugs. And if you use these drugs, do it with a diet and exercise. So we have 4 different categories. We're just going to jump right in. First category is HMG-CoA reductase inhibitors. These drugs are statins. So that means statin is going to be the suffix at the end. So the first drug here is atorvastatin. The brand name is Lipitor. You've heard of this drug before, I guarantee it. So the overall goal is to decrease cholesterol production and increase LDL recycling by the liver. LDL is the bad cholesterol, HDL is the good cholesterol. So just things to remember. So they're trying to increase LDL recycling by the liver, trying to get rid of that. So this can be used for patients who have hypercholesterolemia. So they're trying to decrease the LDL levels, increase the HDL levels, and decrease triglycerides. Adverse effects can include GI issues, a rash, increased liver enzymes, myopathy, which is muscle pain. And this myopathy can lead to, let me see if I can say this right, rabid myolysis. I think that's the low. I think you say rabidomyolysis. I don't know how to say it. I'm just going to show you the word. See, it's right there. This is, there is an increased risk of rhabdomyolysis, however you say it, when the patient is also using fibrates, which we're going to get to in just a hot sec. So contraindicated in patients who have biliary obstruction, liver dysfunction, or liver disease. And a nursing implication for HMG-CoA reductase inhibitors is that the patient cannot have grapefruit. The next category are bile acid sequestrants. And the 2 drugs here are colisivim and cholestyramine. Again, I'm butchering the names, but there you go. This drug is a pill. This drug is a powder. So like they would take the powder and like mix it up with some water and chug it down. Pill, powder. There you go. Then the brand names are Welchol and Sequestrant. Very fun. Okay, so these drugs prevent the reabsorption of bile acid in the small intestines, and it's an insoluble complex that's excreted in the bowel. So this can be used for patients who have diarrhea, who need relief of biliary obstruction, and it can be used with a statin. Remember, this drug over here is a statin. The response is that the patient is going to experience lower LDL levels. The adverse effects, since it's working in the GI, are going to be GI-related, so diarrhea, GI issues, and constipation. And nursing implication is that they need to take all of their oral meds either 1 hour before or like 4 to 6 hours after the administration of this drug. Nicotinic acid, which is vitamin B3 or niacin. This is going to increase the activity of lipase and decrease the metabolism of cholesterol and triglycerides. It's effective and inexpensive, and when combination, especially when comboed with other lipid-lowering drugs. This can be used. It can be used to decrease triglyceride levels, decrease total serum cholesterol, decrease LDL, and increase HDL levels. Adverse effects include flushing, which you can prevent by having the patient take aspirin 30 minutes before administering this drug. Another adverse effect can include liver dysfunction, GI distress, and pruritus. And nursing implications is that the patient's going to want to taper up to the ideal dose over time and also take this with food. Fibric acid derivatives, which are fibrates. The 2 drugs here are gimfibrazole, probably not saying that right, and fenofibrate. The 2 brand names are Lopid and Tricor. This is actually activating lipase in the body, decreasing the release of free fatty acid from adipose tissue, increasing the secretion of cholesterol in bile, and it stops the synthesis of triglycerides in the liver. So this primarily, the goal of this is to decrease triglyceride levels and increase HDL levels. The adverse effects are going to be GI issues, blurred vision, increased prothrombin time, so like an increased bleeding time, and increased gallstone risk. The nursing implication is that they cannot take this with a statin because of the risk of rhabdomyolysis. I hope I say that right. So just remember that fibrates don't really play well with others. So these are your statins. Statins can be taken with bile sequestrants. They actually kind of work well together. This one's just kind of big chilling on its own. But these two guys, HMG CoA reductase inhibitors, do not play well with fibric acid derivatives, which are fibrates. So these two, not a good thing. These two, okay. And they don't really have any information on this little buddy. So those are the 4 different categories of anti-lipemic drugs. So there you go. I hope this helps.